Welcome to part two of our series on the client meeting process. In this session, we're really going to look at Medicare supplement plans and how we as agents facilitate that conversation, that educational conversation with regards to Medicare supplements. I did a live webinar of this and I had to go back and make a new recording because we were getting a lot of questions on that webinar about specifics, different types of Medicare supplement plans, some of the varieties and some of the nuance that we learn as agents about representing these plans to our clients. I do want to put a disclaimer out here for this session that while we want this to be somewhat comprehensive, a 4-part training series on the enrollment meeting, we are creating a PDF guide with links and resources for you. The purpose of these trainings is not to teach you everything that you need to know about every product. We're really focused here on the enrollment meeting process that I'm going to have up for you on this slide right here. All the nuance and all the, specific learning that needs to take place with all of the individual steps and products along this process. There's no way we can cover all that in one guide or in a short webinar series. That's where our industry learning, our industry research, taking our AHIP certification, our carrier certifications, and the NABIP, if you choose to do that certification pathway, those are going to be much more comprehensive. We're here to really teach this timeline and to make sure that everybody that we work with understands the process and has a good approach to meeting with their clients. I apologize that this slide right here is a little bit off on the header. I imported this to Teams to make sure that the recording flows correctly. When you get the actual guide, it won't be overlapping like that, but it's just one of the things that you deal with sometimes when using Microsoft. But this is our meeting process. What we want to have for you is a simple, repeatable formula for clarity and success in those meetings with our clients and your clients. And so we try to make it pretty easy. We start off by presenting Original Medicare. And we had a session, you can find this on our YouTube channel on TLC Agent Hub, where we went over in a lot of detail how we talk to our clients about Original Medicare. We referenced the Medicare cost sheet that goes over the Part A and B rates and the IRMAA rates. And that sheet is available for you on TLC's Agent Hub. So that's step one. We want to make sure in our meetings, we're teaching our clients what Original Medicare is, what it covers, what the different deductibles mean. And you can find that in our training that we have posted on our YouTube and on TLC Agent Hub. Step two, we always want to make sure that we at least go over the IRMAA amounts. That's that income related monthly adjustment amount. We never want to leave a client from our meeting with that chance of them not knowing that they might have higher than the standard Part B premium, and they might have that additional IRMAA impact their Part D premium as well. If you have questions on that, again, go back and check out our Medicare Basics webinar. Today's focus is going to be Medicare supplement plans. So we build the foundation going over Original Medicare. We make sure they understand all those coverage amounts, and we segue into the Medicare supplement plan. And if you think about it, it makes perfect sense, right? We teach what A and B cover, which brings awareness to potential costs. And it just makes sense to go to Medicare supplement next. The reason being, I'm going to show you a few practical examples of why we do that. But if we use that sheet, and I'll show you that before we leave here today as well, to go over those Medicare costs, and then we show them a Medicare supplement plan guide sheet, it's going to be so easy for them to understand what a Medicare supplement or a Medigap plan actually does. And so that's why we go in that order. We go into a Medicare supplement plan, and then we get into prescription drug plans. And then lastly, we show Medicare Advantage plans. Certainly, you don't have to follow this sequence. We have just found that this works incredibly well through a lot of years of working with clients and trying to help them to understand their options. So today, we're going to focus on this third piece, which is the Medicare supplement plan piece. And then we'll have 2 more sessions that focus on prescription drug plans and Medicare Advantage plans, and 1 session on what should you do after that enrollment meeting as an agent. Step 1, we already touched on. That was presenting Original Medicare. That was covered, as I said, at length in our Medicare Basics webinar and course. You can find that on TLC Agent Hub. And we already kind of just outlined the specific reasons why we do that, why we want to teach original Medicare. And please think about this. Someone's coming to you for the first time to learn about Medicare. Many people are confused about the difference between Medicare and Medicaid. Many people don't know the fact that Medicare is for individuals and you can't have a family plan like you used to. Many people have no idea that Part A comes with a benefit period deductible or what a benefit period actually is. And then Part B has an annual deductible. All of this creates confusion because it's all new. And then we mix in all the letters and all the different options. And so we want to start with that foundational piece, going over the Medicare cost and the IRMA, using that Part A and B coverage guide that we have on Agent Hub. And that helps solidify their understanding as to what original Medicare is and ultimately why they need either a Medicare supplement plan with a standalone drug plan or a Medicare Advantage plan. So today, what we're going to do is first, again, because this came up in the live webinar, I went back and added a lot more educational content here. What are some key Medicare supplement concepts that we all need to know as agents? You can see them on the screen. We're going to cover all of those here today. And then we also want to make sure that we as agents also carefully explain, as I said, that Part A benefit period piece, the Part B deductible, and Part B medications. All of those topics were covered in that Medicare Basics webinar. So please go back and check that out. For today, let's dive into Medicare supplement plans. First and foremost, there are quite a few different Medicare supplement plans. And I found this table on Medicare.gov. It is a really nice table because it can show your client with these green check marks what the coverage is line by line for each available plan. I find this is a really great thing to have a copy of on hand and to hand that over to your client. And then we can quickly explain why most of our clients go with Plan G, which is right here. Most of our clients go with Plan G because it is now the most comprehensive supplement plan coverage available. It's basically going to cover all of their Part A and Part B Medicare covered expenses, keywords. It's going to cover all of their A and B Medicare approved, Medicare covered expenses minus the Part B deductible. And we'll take a closer look at that in a few minutes. Some people go with Plan N because it's similar, right? You see all the green check marks, but then it also doesn't cover the Part B deductible. And it also doesn't cover excess charges, which is an important topic that we're going to get into here today. Plan N, if you look up here where this little asterisk is, also has copays for certain office visits and the emergency room. So we want to learn, we want to study the plans and make sure that we know what this chart means, what the check mark means, and especially what some of the asterisks might mean by way of coverage for our clients. At the bottom here, we do have a link for you. If you're looking at the PDF guide as you're watching this, you'll be able to click that link right in the PDF guide and go right to Medicare.gov and then download a copy of that chart. So first and foremost, let's talk about the Medigap open enrollment period. On purpose, in creating these slides, I'm going to interchangeably use Medigap and Medicare Supplement. And the reason for that is that's exactly what the government does. Most things on Medicare.gov will say Medigap. Most plans from carriers will say Medicare Supplement. It's the same thing. So I'm going to use that terminology interchangeably throughout our presentation. But under federal law, you get a 6-month Medigap open enrollment period. It starts the first month you have Medicare Part B and you're 65 or older. So if you have Medicare Part B and you're under 65, many states do not allow you to get a Medigap plan. But that guaranteed issue piece in most states, again, is at 65, starts the first month you get Medicare Part B. And what you can do is enroll in any Medigap policy. You can enroll in any Medigap policy during that Medigap open enrollment period. That's a good thing, right? Because you're generally going to get better prices. You're generally going to get more choices. And then you can buy any Medigap policy sold in your state, and insurance companies, really important right here, cannot use medical underwriting to determine whether to accept your application. In other words, they cannot deny you coverage due to your health. We have 6 months. So this is a 6-month enrollment period, and it gives that free access to these policies, irregardless of somebody's past and present health conditions. We want to make sure to go over this in our meeting. And sometimes when I do it, I feel like I stress it so much because I just don't want a client to come back to me and say, Dave, you didn't tell me about this. And now 12 months in, I want to go from an advantage to a supplement, and I have a health condition and I can't get it, or they're going to rate me higher. I never want that surprise from my client because they're going to be mad at me if they don't understand this. But admittedly, sometimes when I talk about this with them, I feel like maybe I'm giving them so much information about it that they feel like they have to choose it. I don't want to do that either. I just want them to know that this is an important decision when they have this Medigap open enrollment period, especially if they have existing health issues. They may never be able to get a supplement plan again in their life, or it will be so expensive that they just can't afford it if they don't take it at this point in time. As agents, it is an imperative that we understand this enrollment period and that we go ahead and make sure that we explain it carefully to our clients and have them tell us that they understand. I also found this on Medicare.gov. I was going to make it. Unfortunately, they've started to make a lot more infographics for us. But this is the Medigap open enrollment period infographic. It shows exactly what we just talked about. It starts the first month that they have Part B and they're 65 or older. Then we have months 2, 3, 4, 5, and 6, and then it ends. And after that, they're subject to underwriting in certain states. I'm not going to get into this today because it's a big topic. And again, we're here to teach you the process of enrolling people today. But you want to research in your state whether you have the birthday rule. Because if you have the birthday rule in your state, there are provisions in state law that allow some individuals in some states to go from a Plan G supplement to another Plan G supplement the month of their birth or 60 days around their birth without medical underwriting. Now, they don't let you go from original Medicare to a supplement without medical underwriting, or from a Med Advantage plan to a Medicare supplement plan without underwriting. But they do let you go from Plan G to Plan G, or Plan N to Plan N, or in some states, they'll let you go from Plan G to a plan with lesser coverage like Plan N without underwriting. On top of this Medigap open enrollment period, it would also be really wise to research whether or not in your state you have the birthday rule and what the guidelines are in your specific state. We also want to understand excess charges. If you have original Medicare, the amount the doctor or other healthcare provider is legally permitted to charge is higher than the Medicare approved amount. The difference is called excess charges. That's an important thing to know. Go back to that chart. Here, let me bring it up for you again. Remember the big difference between Plan N and Plan G. Here's Plan N over here. Here's Plan G over here. One of the red X differences is that Plan N does not cover excess charges. Plan G does. So if you live in a state that doesn't have a lot of guidelines to prohibit balance billing or excess charges, your client, if they do not have Plan G and that provider bills above the amount that's Medicare approved, or that hospital or that ambulance company, your client would be responsible for those excess charges unless they have Plan G. Really important idea to understand. Some carriers offer discounts. That could be for your gender. Typically, women have lower cost rates on Medicare supplement plans. Non-smokers almost always have lower cost rates. You could have a married couple rate or multi-insured rate or household discount. Some carriers will discount your rate for paying yearly or paying your premiums using electronic fund transfer. It is so hard for us at the national level to know all of this fine detail and nuance for the med supplement plans that might be available in the area that you're working with clients. Just like we do with Med Advantage, we have to do market research, dive into the plans, make our own spreadsheet, And we can do it. We don't have to look at all of them. We can use some of the tools I'm going to show you today to check rates and then zero in on within those rates that are competitive in our area. What plans offer certain discounts? Do they offer a fitness membership? Do they offer a household discount? But we want to know that information because as we go back to this chart again, the actual Part A and B medical benefits are defined by these government rules, right? So CMS and the government have plan designs that are approved for Medicare supplement plans, but then the carriers have the ability to also have extras and discounts that go above that standard coverage that we see on that chart. Real important area of research for all of us as brokers that want to help people to the fullness of our ability. Now let's talk about the evolution of the Medicare supplement plan design and some of the variations that we see that go a little bit outside the norm. When you're doing quoting and we show quoting today, we will see a Medicare Select plan option. What this means is it's a type of Medigap policy that may require the member to use hospitals and in some cases doctors within its network to be eligible for full benefits. So one of the salient points that we talk to our clients about, especially with Plan G, is your insurance is through Medicare. Part A and Part B is your coverage. That supplement plan is insuring you against your out-of-pocket risk associated with original Medicare. Again, that's why we go over Part A and Part B in every meeting. If you choose a select plan, you are now choosing to, in some cases, for some of your care, have to participate with network providers. Some people are okay with that because the Medicare Select plan almost always has a lower monthly premium, but you now have coverage that, again, includes a network. A second thing that's available is there are plans that have a high deductible. So it's a high deductible Plan G. If you have high deductible Plan G, we're making this video in 2025, you as the insured have to pay $2,870 first. That's your deductible. And then after that, the plan will start to pay. You may also have to have a separate deductible of $250 per year for foreign travel and prescription drugs covered by your Medigap policy. So Part B drugs may have that extra deductible tacked on. Again, lower premium, but more financial risk for the insured than standard Plan G. I'm on standard Plan G. All I have to pay is whatever that Part B deductible is, and then my Part A and B Medicare covered items are taken care of by that supplement plan. And now we have this newer hybrid type of Medigap policy called an innovative Medicare Select plan. We've started to see these emerge with some of the carriers that we work with. Very similar to a high deductible plan where you have to pay that high amount before the plan covers those Part A and B costs. But the difference between an innovative and a high deductible is these plans phase out the high deductible amount and move towards a traditional Medigap plan with that Part B deductible amount only after initial term, typically 3 years. So you're starting off your Medicare journey, say at age 65, with a $2,800 or so a year deductible Plan G. And then 3 years later, your plan converts to a standard Plan G that has whatever the Part B deductible amount is. You're going to see more and more of these start to crop up. And as agents, we just have to dive in, make sure that we're either going to that carrier training or looking at the carrier's online trainings to really understand what their plan structure is and what it means for our clients. But those are some of the variations, and I'm sure there's more. But again, we want to teach you the enrollment process. I'm only outlining some of these details because we were asked by quite a few people about some of the things that I've added to our guide and presentation. So here's where the rubber meets the road. Here's what today's session is truly about. How do we present and teach our clients about their Medicare supplement plan options? I'm going to show you multiple methods for rate comparisons and then kind of show you the process that you can use with Smart Enroll. And we're going to look at Smart Enroll, how you can use a carrier enrollment kit, which is a really good tool for this. And then how you can use Medicare.gov. We'll talk a little bit about a rate sheet binder, which I still think is a great idea for MedSups. Then we'll wrap up with showing you a tool that we have on Agent Hub called MyQuote, which is a really, really great instrument for doing market research, but not enrollments. And then when you get this guide, so again, if you're watching this, while we're taping these here in the fall of 2025, the guide will not be released until we finish all of the pieces of this, which is a 4-part series. But in the guide, we will also have links for you to some nice Medicare.gov resources that might help you out as you start to step through this process. So we're going to dive into some of the demonstration here. I'm going to go ahead and switch my screen and we'll get started. First and foremost, we're in the process literally right now of redesigning our entire website at TLC. But we always want you to come to Agent Hub. Agent Hub is going to be that place where you're going to have access to the information and the resources that you need as a partner and an affiliate of TLC Insurance Group. So I'm going to go ahead and log in real quick. We're going to go to the dashboard and I'm going to go to downloadable forms in the left menu. And we talked about this in our presentation. I just want to show you the Medicare Part A and B and IRMA cost document I was referencing. And here it is right here. So this is such a valuable resource. I would have a laminated copy of this on my desk and we use it all day, every day in our meetings. Make sure you go grab one of these. And as we presented in that timeline, make sure you use this and go over it in that process. But that's available for you right in Agent Hub, downloadable forms, and your IRMA right here, IRMA cost sheet. So 2025 Medicare Part A and B and IRMA cost sheet. Very soon, we will likely be posting the 2026 version. We're at the whim of the government as to when that will be released. But from the time it is until the end of the calendar year, you will have 2 forms available here. One for those current year enrollments, and then one that we'll use during AEP and talking about how things look in 2026 or the subsequent year. So let's start with Medicare.gov because you can use Medicare.gov for rates for MedSubs. And so you might use this for market research. I'm going to go ahead and click Find Plans Now. I'm going to go ahead and drop in a zip code. And I'm going to click Continue. We're going to choose Medigap policy. Age, 65. We'll go male, no tobacco. Do you get a household discount? Let's say no in this case, and we'll go ahead and update prices. So it's going to give me 12 Medigap plans. It's going to give me a rate range right here, right? 117 to 471 for Plan A, Medigap Plan A. You could see pretty much routinely, Medicare.gov uses the word Medigap. So let's go down to Plan G. Oh, here's high deductible, which we talked about, right? Plan F, high deductible. Plan F, if you're not familiar, is really not available to anybody who turns 65 right now. If you didn't turn 65 prior to January 1 of 2020, you can't really buy Plan F. So now we have Plan G available. You can see we have Plan G and then high deductible Plan G. We talked about this, the deductibles for regular Plan G. You have a $0 Part A deductible, $257 for Part B. And then down here, we have the total plan deductible on the high deductible version is $2,875. So we're going to go and look at Plan G. We could look at plan details here. I'm not going to do that for the interest of time. I'm going to go to view policies. And then I'm going to go ahead and take a look at 45 policies offered in our state. Sorting premium high, low to high. Premium is sorted low to high. You can see we have Physicians Select, Insurance Company, and this is an innovative plan. And so now we see that word innovative that we talked about. Again, we have a low premium, but we know from what we said earlier that innovative plans typically have that high deductible amount for the first 3 years and then convert to a standard Plan G. In most cases, we want to dig into that carrier's specific details, their outline of coverage for that plan. But I could see rates for all of the Med Sup plans available right here on Medicare.gov. Again, it's good for market research. It's good for rate comparison. However, I cannot do any enrollment from here. So I would have to go to the company website. As an agent, I would have to then log into the company's portal, and then I would be able to do that enrollment there. We have an easier way for you. Let's go back to our Smart Enroll dashboard. All of you should have TLC's exclusive enrollment platform, Smart Enroll. And I'm going to go ahead and use one of my existing clients by clicking search. I'll type in their last name, and I'm going to go ahead and use myself here. I put in 1952 for my birthday, really aging myself. And at the bottom here, I'm going to go ahead to continue to plans. Now, in the first session of this 4-part series, we talked about steps to take before the meeting. And in that training, I went over adding providers, the pharmacy, prescriptions, and getting the compliance scope of appointment form before we sat down with our client to do what we're doing right now, which is going over options. So in my meeting, my client's here. We've gone over this, which we explain in our Medicare Basics training, very detailed. And then I'm going to go into Smart Enroll and say, well, let me show you what a Medicare Supplement plan rate would be. I can click on the Medicare Supplement Plans tab. And I'm going to edit my answers just for demonstration. You do have to re-enter the date of birth here sometimes. You pick the effective date. I'm going to go with September. Gender, payment method, monthly is the standard choice. Are you going to be signing up a spouse? I'm going to go no. Electronic fund transfer, yes. And then I put in part A and B effective dates. And then I choose the reason why. So I'm new to Medicare. I'm turning 65. I'm going to have guaranteed issue. Continue to plans. And I'm going to sort these by plan premium low to high, which is the standard sort. It will already be that way by default. And then I know my client wants plan G, so I'm going to go to filters. And I'm going to select plan G. And I'm only going to select plan G, not high deductible, because we talked about those differences in our meeting, and they do not want a high deductible plan. I'm going to click apply. And then I only see a few carriers here right now. So for complete transparency at the top, let me add non-licensed to make sure there's not a really competitive rate that I'm not currently appointed with that carrier for. Let's go back to filters. I think it knocked it off on me. It did. So if you change to non-licensed plans, maybe do that before you filter out the plan type. And so now I can see the lowest rate is $166.72 for somebody who was born in 1952 and is a male. But look at this. So the key word is select, right? 166.72, but it's a select plan G, which means on that plan, my client's going to have to use a network for potentially certain office visits and the hospital. They probably don't want that. So we just need to make sure that we understand select and that we can explain that. So here's a Humana plan, attained age rating. That means every single year, my rate is based on how old I am, basically, is what attained age means. If you forget that when you're with your client and they ask, you can hover over this. It's going to tell you. Premium is based on current age and may increase with age. Future rate may increase due to inflation and other factors. But that plan has a $191.07 a month premium. Can add it to the compare. AARP supplements. You're going to see this. There are two types. So we have insured by United Healthcare Insurance Company of America, Plan G 21098. And then we have insured by United Healthcare Insurance Company 226. So I'm going to add those both to compare, and then let's go look at the comparison by clicking compare. So now I can see side by side, 3 different plans. We have the Humana Achieve 191, United Healthcare or AARP insured by United Healthcare Insurance Company of America, 210. AARP Plan G insured by United Healthcare Insurance Company, 222.96. So what's the difference? These are all Plan G. Well, we have rate from one, or premium, right? Low, middle, high. Then we have rating method, attained aged, community rated. What's community rated? And so that's something that you're going to want to research. I don't want to get too deep into explaining that. But basically, with community rating, they look more at the population in an area and they establish a maximum rate. So AARP uses community rating. And so what they basically do is they look at an area, could be a state, could be a portion of a state, and they create something called a standard rate. And that standard rate is the maximum rate that you're going to pay on their plan, which we'll be able to see in their table. And then they apply a discount that reduces that rate. And that discount is bigger the younger you are. And in the case with some of these AARP supplement plans, they also band together. So on this one, this is the United Healthcare Insurance Company of America insured plan. 65, 66, and 67, there is no age-related rate increase. Now, there might be a one-time-a-year plan percentage increase, but they're banding together the first 3 years and keeping it all at the same 45% discount off whatever the maximum rate is. And so that's kind of how it works. It's a little bit different. Here's one of the tables. This particular one is for female non-tobacco. And you can see it's Ohio Area 1. So what does that mean? Well, sometimes you have to dig into these books. Let's see here. I'll show you. So here's what Area 1 is, right? It's a certain list of zip codes. So they're looking at this area, this community, creating a rate table, creating a maximum rate, and then they have a discount that they roll off for each year as you approach the youngest age. So again, here's a rate table. This one is male, non-tobacco, and tobacco. You have non-tobacco here. You have tobacco here. Age 65 through 67 are a banded rate, 176.47. No age-related increase as you age through those first 3 years. Again, you can have an across-the-table percentage increase every year that affects every rate that we're looking at. But that's the same of other plans too, right? If you're on an age-attained plan, every year you get an age increase potentially. And then you also, the carrier has the right to adjust this entire rate table by a percentage every single year. So your client may very likely have 2 plan premium increases on their MedSup rates. And it's really important that we understand and explain that to them. And you'll see down here, look at this disclaimer at the bottom. The rates above are for plan effective dates June 2025 through May 2026. So in the case of these AARP plans, they're allowed to increase this table every June. But you're not going to get that table increase, right? That across the plan increase. You're not going to get that plus an age-related increase on this particular plan the first 3 years that you're insured. So these rate tables are very valuable. I like to find the most competitive plans in my area, and I go get these rate tables from the carrier website. This is a whole book that I can download straight from the carrier. It's an enrollment kit. All of them have them online as PDFs, and then I can have copies of those rate tables in a binder. It's also a great place to find some of the discounts that we were talking about when we do our market research. So here's a 12% multi-insured discount. Save $4 off a month for electronic fund transfer. But we can also see those rates here on Smart Enroll, right? 210 for this individual, for this plan, 222 over here. These two plans are very similar. The one that is Insurance Company of America, though, does not have a fitness membership. It has a lower premium. It has a higher multi-household discount. And then this one over here, United Healthcare Insurance Company, has a fitness membership. It has a 4-year. Let's go back to this rate table here. It has the first 4 years, there's not an age-related increase. So for the first 4 years, there's not an age-related increase if you go with that higher premium plan. So the table that we're looking at is for the AARP Plan G through, it's insured through United Healthcare Insurance Company of America. You still have the 3 years locked in without that age-related increase. The more expensive plan locks in your rate increase from an age standpoint for the first 4 years. I know I keep saying this, but again, that doesn't preclude you from having that across the table rate increase that the carrier is allowed to do once a year. So really between these two plans, because I've done my market research, I know the discounts, they're picking between a gym membership or not, that locked in group of not having an age-related increase, and a few other discount factors. So that's why we have to do market research. But let's say we explain that to our client. Why we like doing rates right here in Smart Enroll is I can go ahead and add that policy to the cart. And I can go right to the enrollment site by clicking continue to apply. I can't do that on Medicare.gov. If I'm using the enrollment kit, I can find the rate. I can go to the very end of this. I'm not going to do it by scrolling all over the screen and making you dizzy. I can fill out a paper application and submit that to the carrier. I prefer electronic applications. They're easier to track. It's way harder to make mistakes. And we can do it right from TLC Smart Enroll, which makes it super, super easy. Let me go back one screen and let's get into a few more things here. So while we're here, what's great is we can also click View Plan Details. And this is going to give us an overview of the coverage. But there's also a link right here to the outline of coverage. And I would encourage you to go through the process of opening up that document. It's going to look very similar to this enrollment kit that I already have on my screen for you. But I want to show you again why we go over Part A and Part B before we get into this MedSup conversation. Okay, let me just scroll down to Plan G. Here we go. So if we use this easy guide that we have for you on Agent Hub, we have 3 columns. This is Part A. This is what the hospital days look like. Here's what Medicare covers. Here's what you pay. If you use the enrollment kit or the outline of coverage, you have the same exact table, only now it shows what the plan pays. So what does Plan G pay? And then what do you pay as the client? And we're required to give our clients a copy of this outline of coverage. It's actually one of the check boxes on every application I've ever seen. Did you provide your client with an outline of coverage? So when we're talking about MedSups, this is the piece we need to go over in addition to those discounts and how those rates work and what the difference is between a select and a high deductible and an innovative potentially. So how does Plan G cover? Let's look at the part. Let's go back one screen here. And let's look at the Part A coverage. If I have Plan G, here's all those costs right here that we go over on our Medicare cost sheet right here. Look, $1,676 deductible in 2025, $1,676 deductible The plan pays the $1,676 deductible and you pay zero. So on the Part A page of the outline of coverage for Plan G through AARP, what do I pay for Part A? Look at this, zeros pretty much all the way down. All costs are covered. So Plan G covers Part A cost. And because I'm building upon that presentation about original Medicare with my client, they can now very clearly see the impact of having Plan G, right? And a really important note, I don't want to keep going back because I know I went over this in the Medicare basics. There's no out-of-pocket limit or maximum for Part A and Part B covered items. So if all I have is Part A and Part B, I could pay to infinity in terms of cost. That doesn't really resonate on a lot of these forms and documents, but that's what a supplement plan does. It's not only picking up your copays and coinsurance in many cases, it's also limiting your out-of-pocket risk significantly more than what you would have had if you just kept original Medicare. So the same with Part B. We see the 20% that would be my responsibility as in Part B insured, but the Plan G is paying that. And so my responsibility, if I have standard Plan G, is the current year Part B deductible. Once I meet that, my Part B expenses are going to be covered. My Medicare approved Part B expenses and amounts are going to be covered once I satisfy that deductible. So this sheet is an imperative to go over. And we're going to then, they say, okay, I understand. Thank you for showing me that. We walked them through the rate process that we showed you here in Smart Enroll. And then as I demonstrated, we can add that to the cart. And we're not going to do the enrollment yet unless they already know, bar none, they want a MedSup. You don't have to necessarily go over Medicare Advantage, but I would always recommend that you do. You're going to get people that insist that they want a certain plan the minute they walk into your office or you meet them somewhere. Please always just touch on all parts. Just say to them, let me just show you it so I'm doing my job. But for now, we're going to pause on that. And I want to show you some other ways that we can understand Medicare supplement plans and find rates for Medicare supplement plans. Okay? And so what I want to demonstrate now is, let's go back to Agent Hub. And I'm going to go to the dashboard, Agent Dashboard. Okay? So I'm back at my starting point. So I'm going to click on Resources over here in the left menu. I'm going to navigate to MyQuote. Here's what I'm going to say about MyQuote. This is a research tool, much more than a tool that you're going to use in front of your clients. Because it's extra work, I'm going to run a quote in here. And you can't do an enrollment from here. But what I like to use this for is market research. Let's select Plan G and get a quote. And so now for a 65-year-old in that zip code, I can see all these different Medicare supplement plans. And I'm going to go ahead over here on the left menu, and I'm going to click Market Analytics. So what I use this for, when I'm doing my market research, I find the most competitive plans in my area. Let's go back to Smart Enroll for a second. So once I understand the carrier-specific benefits, I can look at these plans and I can get a good idea of what the rates are going to be. They're all pretty tight right now in our area. There's not a huge swing from carrier to carrier in terms of premium. So I'm going to first dive into the carrier plan details right here. Try to learn what the extra benefits might be, what the discounts might be. But once I know all that on my spreadsheet that I make for myself as a broker, I can come in here and look at those same plans or maybe other plans that maybe I'm not currently contracted with that I might want to get appointed with through TLC. I can look at how all the rates stack up for all the different carriers. And I can see on here, this plan offers, look at this, household discount 9%. And that's a roommate discount, meaning I don't have to be married to that person. They just have to live at the same address as me. They don't even need to be on the same plan in most cases if it says roommate. but you got to look into those details. Rating A with a stable outlook, rate type, attained age. We talked about that earlier. Rating class, innovative. So this plan has that high deductible for at least the first couple of years. Now, this is a consideration. I wouldn't say it's necessarily a total red flag, but it is a flag. Years in the market, 2. Not always, but historically, when plans are new to market, they have very competitive rates. And then at a point in time, a couple years in, those rates balloon because of that. They come to market strong to try to get a lot of people enrolled. And then inevitably, they start to take losses and they have to go and up those rates for premium. You can see market data here. There's no increase history because it's too new to market yet. But over here, we can see number insured. So this plan only has 26,000 insureds. And there's a total plan premium collected of $22 million. And they have an 83% loss ratio. So we can learn by looking at this. So here's one by Cigna. It's been in market 5 years, 99.35% loss ratio. Their increase history is charted out here. They actually reduced their premium by 8.9% in 2023, raised it by 3% in 2024, average increase the last 2 years of negative 2.9%. They have 0.47% of the market share. So let's look at a plan from United Healthcare, AARP supplement plans. This plan has been in the market 5 years. Average increase is 8.7%, and that's largely due to the increase the last 2 years. This is a newer plan. Insured lives, 162,000 in 29, loss ratio of 81%. Let's look at the second AARP plan that we had up on our screen. Insured by United Healthcare Insurance Company, not United Healthcare Insurance Company of America. 27 years in market, an average increase historically of 2.7%. Total premium, $11 billion. Lives insured, 3.8 million. Loss ratio, 83.10%. This is a really, really good site to do market research. I can export this as a spreadsheet, which I love to do, but it's not going to be the place that you go to do enrollments. It's for you to be educated about how long that plan has been in market, what's the historic rate increase, and we have to compare apples to apples, right? This doesn't show 27 years of rate increase history, but a 2.7% average over 10 or more years here is a lot more data than what I'm going to get on a plan like this that is in the market for 2 years and has no rate history. These are not reasons to not put somebody in a plan, but they're things to understand and to be able to explain to your client. Because again, we don't want surprises. We want your client to be well informed. That's going to help them be happy and healthy on their plan. And they're not going to be bothering you when something comes up that they didn't expect. Great tool, freely available for you on Agent Hub to conduct that market research. So we've covered what we wanted to cover today. We've gone over how we work through this rating process. But let me just go over it one last time with a lot of clarity so that if you're watching this, you can leave going, okay, I get it. At the beginning of my meeting, I'm going to teach my client what Part A and Part B are and what their costs for that year are using this resource that's available to us on TLC Agent Hub. I'm going to make sure to understand and to explain to them that this Part A deductible is based on a benefit period, and to go over what this information is on this form, that benefit period is 60 days after being discharged from the hospital or skilled nursing. If I'm out of the hospital for 60 days or more, I pay that deductible again. Okay. With skilled nursing, it's a little different. If I'm outside of skilled nursing for 60 days, I'm readmitted to the hospital for 3 days right here. And then I go to skilled nursing again. My 100 days cycle here actually resets. So on the hospital side, it's kind of not to the member's advantage, so to speak, to go back into the hospital outside of 60 days. But on the skilled nursing, it actually is somewhat to their advantage. If they have a 60-day break and end back up in skilled nursing, they get coverage again at that point. I'm going to go over Medicare Part B costs and coverage. Make sure they understand that if I have original Medicare Part B, I have a $257 annual deductible, and then I'm responsible for most things for 20% of the Medicare approved amount, both A and B, with no out-of-pocket limit. I'm going to go over this table for income-related monthly adjustment amounts. I'm not going to talk a lot about it now. If you need more information on what this means and how to talk about it, check out our Medicare Basics webinar or our online course. I'm going to go over this, and my very next step is going to be to use something like this, either from online, or I can order the enrollment kits from the carriers and have hard copy books of this right on my desk, ready to go, because now I can explain that I showed you these 3 columns on my Medicare A and B sheet, and here's what you would pay for Plan G. And maybe you have Plan N, maybe you have other supplement plan sheets like this printed out. The majority of my clients come from financial advisors, so they're high income and they typically all want Plan G, but you might need those other plans in your toolbox, especially Plan N. I showed them what Plan G covers. Here's the Part A sheet. Here's the plan Part B sheet for Plan G. You pay the $257 deductible, and then after that, really good coverage. I'm making sure I understand Part B covered drugs and explaining that. I make sure I understand excess charges, and I'm explaining that. If you need review on those topics, dive into our other trainings. Once I explain this to them and make sure that they understand how a supplement plan works alongside original Medicare, I'm moving into the rating process. And for me, I'm going to do that either in Smart Enroll. I can do that on Medicare.gov. I can look at rates on MyQuote. But for my purposes, and if you're a new agent, my recommendation is use a combination of Smart Enroll and create your own rate book. Get those rate sheets that I showed you earlier from the carriers, put them in a binder, update them when that plan has their annual increase. It's a great way to be able to compare additional rates, but Smart Enroll truly is the easiest way to go. If they like a certain supplement plan, I can add that to the cart, and then I can continue my presentation, which we're going to do in our very next session. So our next session, this is 2 of 4, we'll be talking about how we go over prescription drug plans and Medicare Advantage plans coming out of this conversation with our clients on Medicare supplement plans. I hope this session was helpful to you. We hope you turn in to the next 2 in this series. And if you happen to be watching this and you're not a TLC affiliated agent or partner, but you want more of these resources that you're seeing and more of our training and education, because we do have some that are available freely to the public and the community at large. And we have others that are maintained strictly for our affiliates. We'd love to have that conversation to help you continue your learning and your growth as an agent. As always, don't hesitate to reach out if you need help with any of the things that we've gone over. Our team at TLC is here to help you